This is QTV News and I am Mumudu Kajaga. Thank you very much for joining us. We look at our top stories. The Ministry of Health on Thursday inaugurated the National Health Insurance Authority Board, which will implement, operate and manage Gambia's first ever universal health coverage insurance scheme. The National Center for Arts and Culture, in partnership with the Gambian National Commission for UNESCO, today joined the rest of the continent to celebrate Africa World Heritage Day. Give One Project Gambia and partner Paradigm Initiative on Wednesday held a digital rights and inclusive forum under the theme Towards a Digitally Inclusive and Rights Respecting Africa. Omar Pierre Bojang, a Gambian residing in Germany and founder of Wipso Charity, explains to QTV how he lost his sight after waking up from a coma following a brief illness. In international news, the world's only nonuplet, 9 babies born at the same time are in perfect health as they celebrate their first birthday in Morocco, according to their father. Those were the main news headlines, and now the news in detail. Welcome and thank you very much if you're just joining us. This is QTV News. The Ministry of Health on Thursday inaugurated the National Health Insurance Authority Board. The board will serve as the governing body for the National Health Insurance Authority, which will implement, operate and manage Gambia's first universal health coverage insurance scheme. Murlamin Choi has the details.
It is a first step towards making operational the National Health Insurance Scheme, which was enacted 5 months ago and came into effect in January this year. The National Health Insurance Authority Board is being inaugurated by the Health Minister, Dr. Ahmad Elamin Samate, witnessed by the new board members.
We appreciate your willingness and commitment to serve this noble institution, which will provide an oversight to the authority. I have the conviction that the breadth and the depth of experience and expertise represented by the board membership will no doubt provide the authority with much needed insight as we consider the many challenges facing the management of the newly formed authority.
The board comprises a chairperson, the permanent secretaries of the Health and Finance Ministries, the Director of Health Services, the Managing Director of the Social Security and Housing Finance Corporation, the Chief Executive Officer of the National Health Insurance Authority, a representative of the Health Professional Councils, and the Commissioner of Insurance. The non-ex officio members are appointed by the President in consultation with the Public Service Commission.
In view of the foregoing, distinguished board members, ladies and gentlemen, I can humbly submit that you are set to tackle some of the most difficult issues that the scheme will be facing in the coming years, from the evolution of public and private insurance providers to the globalization of health insurance management.
Among other oversight functions on the National Health Insurance Authority, the board has the mandate to ensure that the Insurance Authority performs its mandate properly and effectively and in a transparent and accountable manner by overseeing the development and implementation of strategic plans, human resources, and strategic policies.
It is also about social justice and equality. It is simply about the way countries share their resources for health, determining who gets what. In simple terms, it is about the distribution of the wealth of the country for the health of each and every citizen, regardless of the socio-economic status of the individuals.
Melville O. George, the National Health Insurance Authority's board chairperson, sees the health insurance scheme as a promise that must be delivered on for the country.
We must pull together, as the Kenyan Kiswahili word says, harambe, coming together, pull it together. I pray that for the stakeholders, each will live up to the expectations as dictated in the Act, particularly the capitalization of the fund. Any delays may impact on the scheme negatively.
To perform the Health Insurance Authority's functions, all staff but the Chief Executive Officer will be appointed by the board. tenure of the non-ex officio members is fixed to 3 years and they can be reappointed only once for another 3-year tenure. Mahmoud Lamin Choi, QTV News.
The National Center for Arts and Culture, in partnership with the Gambian National Commission for UNESCO, today joined the rest of the continent to celebrate Africa World Heritage Day. Omar P. Jallo tells us more.
The theme for this year's celebration is Africa Heritage as a source for humanity, innovation and resilience. The day has been celebrated since 2015 and highlights African cultural and natural, tangible and intangible heritage across the globe, raising awareness of the benefits of its promotion and preservation, as well as the related challenges the continent faces. Lamin Jaju, a senior program officer at UNESCO NATCOM, said in the face of climate change, armed conflict, and the ongoing COVID-19 pandemic, among other challenges, African countries must ensure that their remarkable heritage can adopt and strive. Hence the local chosen team, schools, community guides, teachers and UNESCO World Heritage, a useful discussion.
Let me please highlight that even though heritage links us to our past, it should, however, spur us to leave this world as a better place for generations coming after us. Culture must be seen as an integral part of our national development efforts. Among other things, it is only through the recognition of the cultural dimension of development that our country can chart a course of development that will meet the needs and aspirations of the Gambian people.
The Assistant Director of Museum and Monuments at NCSC, Mamad Salah, said the Gambia's UNESCO World Heritage Sites have the great potential to improve livelihoods and support strong and sustainably resilient communities against hunger, unemployment and the negative effects of climate change.
The percentage of Africa represented in the World UNESCO list is about 12%. Right? And then this is a very small percent in the list of World Heritage. And then if you look at also in the listing of these heritage sites, most of the African heritage are also endangered. And then, because of that's why they want to create more awareness to Africans to be able to protect and also preserve, conserve the heritage of Africa.
Seni MC said the marketing manager NCSC outlined the day's importance and future plans.
On the 12th of May, we're having a series of competitions with schools that are in Kirbach. So there will be quiz competitions, there will be drama competitions regarding the day, to celebrate the day. So it's not only today, it has started way before the Ramadan, today and on the 12th of May.
A series of community and school-based initiatives such as debates, quiz, workshops, cultural performance and cleansing exercises to sensitize the public about the significance and the potential of UNESCO World Heritage Site are planned. The Gambia has 2 such World Heritage Sites, one at Kunta Kinte Island and the other at the Stone Circles of Senegambia, which will be featured among the activities marking this year's celebration of Africa World Heritage Day. Reporting for QTV News, I am Omar P. Jallo.
Well, my apologies there in that story. It's Africa World Heritage Day rather than World Africa Heritage Day. Bit of a mix up there. Still on the news, we live in a world where many of us interact digitally in our personal, professional and business lives, and in doing so, share a lot of personal data. In recognition of this, Give One Project Gambia and partner Paradigm Initiative PIN on Wednesday held a Digital Rights and Inclusion Forum under the theme Towards a Digitally Inclusive and Rights Respecting Africa. Omar P. Jallo attended the opening and files in this report.
The forum brought together stakeholders from the private and public sector, including government, academia, the media, human rights institutions, civil society and researchers. The event aims to create platforms for discussing key issues, develop action plans to enhance digital rights and inclusion in Africa, and increase networking and collaboration on digital rights and inclusion. In his opening remarks, the country coordinator Give One Project Gambia Aliou Sow said the forum will give participants an opportunity to understand that personal data protection is a human right and allow them to look at the existing laws in relation to international standards and the importance of consent in data processing.
There's a lot of data harvesting happening in the country. If you go to banks, sometimes they ask you certain questions. You go to the doctors, they ask you certain questions. You're like, is this even relevant to like what I'm doing? So this thing is happening here. We've seen the biometric identification process, our passport systems, even the voter registration. They collect a lot of information. How are these informations being managed? Who is looking at these information?
Ibenga Sizan, the Executive Director, Paradigm Initiative, said the 2022 forum is PIN's 9th edition and is a platform for building communities of practice around privacy, affordable internet, gender and ITCs, disability rights and ITCs, health surveillance during COVID-19 times, internet shutdowns and similar themes.
And I think it's important as we have our conversation today to think about what role you can play as an individual, what role you can play as a member of the business community, of the private sector, of civil society, or even of government in making sure that we move closer to a rights-respecting continent.
Isaac Keita, the Vice President of the Gambia Press Union, said the forum is timely, coming a day after the commemoration of the World Press Freedom Day.
We should be committed, per se, to making the change, not just by speaking, but by acting. Let it be that interactive state that will be able to provide frank discussions on issues, on the issues that exist, and continue to improve growth as far as digital technology is concerned.
The Secretary of the IT Association of the Gambia, Mbengue Law, also gave her view on the importance of the forum.
We know that this smartphone penetration rate in the Gambia is really high. When you go to the remotest villages in the Gambia, people are using smartphones. So what are we doing to have them participate in the productive discussions online and have their data being protected as well?
Sanusi Drame, a principal ITC officer at the Ministry of Information, said the Gambia government is committed to the formulation of legislations on personal data protection and privacy.
The government of the Gambia, through the Ministry of Information and Communication Infrastructure, is tirelessly working with partners to formulate legislation around personal data protection and privacy.
Hybrid session commenced with a 3-day virtual session from April 12 to 14, 2022, followed by a series of in-person events from April 28 to May 28, 2022. As well as these sessions in the Gambia, in-person sessions will be hosted by country partners in 17 other countries across sub-Saharan Africa. Reporting for QTV News, I am Omar P. Jallo.
We are now going for a short commercial break, and when we return, the news continues.
I am the light goddess. Everything I touch turns into light. I am the light at the end of the tunnel, and my technology is the answer. I am the happiness in your life. I keep you connected, and I am Q-Power. I am Q-Cell. I am Sunubus. We innovate, others follow. Call 111 for more information.
Money, the biggest mobile money service in the Gambia, has taken mobile banking to the next level. Now, you can link your Q Money wallet with your bank account. Yes, link your Ajib or EcoBank accounts with your Q Money wallet and get instant access to your cash anytime. No need to queue at the bank anymore. Transfer funds from your bank account to your wallet or your wallet to your bank account using Q Money Bank Link is the fastest, most secure, and convenient way to transfer funds between your wallet and bank account. For more information, call our customer care on 133. Q Money, Sunyu Kalpe. Terms and conditions apply.
Welcome back, and thank you very much if you're just joining us. This is QTV News. Omar Pia Bojang, a Gambian residing in Germany and founder of Wipso Charity, explains to QTV how he lost his sight after waking up from a coma following a brief illness. As Ansumana Esonyasi reports, Omar is currently in the Gambia that is in the country to implement various projects. More in this inspiring story.
Once a strong, energetic young man with dreams to change his family's life, become a professional footballer, financially independent and excel in life. Omar Pia Bojang is a Gambian philanthropist born and raised in Sukuta, based in Germany and running a charity organization. His charity work focuses mainly on supporting children's access to education, making access to clean drinking water a reality for less privileged communities and women horticultural centers. Having the opportunity to travel overseas, Omar worked as a chef at one of Germany's biggest hospitals. However, a brief illness that started in September 2017, just 5 days before Tobaski, left him in a coma for almost a month. Unfortunately, Omar woke up blind from that coma, faced with a new reality of having to live without his sight and unable to do some of the things he was once capable of doing.
The only thing I remember is when they were putting the machines on my body, then I went coma. I was in coma for 24 days. 24 days. So when I came from this coma, then my eyes are gone. I didn't even realize it. Just as I am sitting with you guys, when I was talking with the doctor, then I tell them, I cannot see. They said, what? You cannot see? I said, no, I'm not seeing nothing. But I myself didn't know that I'm blind, really.
As a young man in Sukuta, Bojang was a renowned footballer in the West Coast region and even played for the national team. His teammates included Gambian legends Jado Cisse and Star Jane, arguably among the best players this country has ever had.
I play everywhere except goalkeeper. Apart from goalkeeper, anywhere you put me in football field, I am playing it. So I started with a team that is called Blue Diamond. Blue Diamond is our team in Jambakunda. That was my first team I played for. And that time I would think we were at the age of 12, 13 years. So at that time I'm more interested in football. I even cannot go to Quran school. I'm not even good at school because I am very playful. My whole time is football, football, football.
Even before losing his sight, Omar was involved in humanitarian work, cooking for Muslims to break their fast at various mosques and conference centers across Germany. He tells me that his current condition motivates him even more to continue supporting the less privileged.
It was also my plan, even to come to Gambia and to go to the hospital to do this work for our patients. Because we have a lot of patients who may die because of the food that they eat. Not that it's the food that makes them die, but we are eating foods that are not good for our sickness that we are having. For example, we said ulcer, liver problems, lungs problems. There are certain food that they are not allowed to eat.
His Whipsaw Foundation has since its establishment become the leading aid provider for many in Sukuta and beyond. Amongst its recent interventions is the construction of a library at the Sukuta Mosque for English and Arabic students. And educational materials and food items worth millions of dollars have been donated to the poor and the needy. He tells me his biggest dream is to help Gambia achieve a good quality healthcare delivery system where access to quality affordable healthcare will be a reality for all. Answane Sonyasi for KTV News.
Well, sad but also inspiring story there. Farmers in the North Bank region have complained about how saltwater intrusion is affecting their farms and are now calling on authorities to help. Don Williams has more.
The flat plain along the Ilasa stretch is a tributary river known as Babolong, which is renowned for the tiny fish caught in the river. The area is also renowned for rice cultivation. However, that now seems to be under serious threat, as Sambu Danfa, a farmer residing in Jajari, explains.
We share these rice fields with Jajari, India, Ilyasa, Jimansara, Alkalikunda and Kachang. We have been complaining for a long time because our income is drastically reduced. During our childhood, there was no salt at this place. It was a thick bush full of trees. The salt intrusion started in 1972 when the Senegalese erected ridges between our fields and theirs. The water stopped flowing and the salt started accumulating. Now, the salt water is destroying our rice. If we have big ridges so that salt water will not flow over, that will help us during the rainy and the dry season. We will be able to create aquariums to rear fish stock. Our gardens are also affected and our mango and cashew trees are dying.
Lamin Marong, resident in a village called India, told us that during the rainy season, the water level rises almost to cover the main highway and their farms. He appeals for the authorities to act.
Government should help create ridges between the village and the river to stop the saltwater intrusion. Also, if they create a passage for water at a river tributary in Kachang, that will be good for us because even fish will come in and out and we can go fishing at any time and the river will not go dry.
Also expressing concern was the acting chief, Bakari Jame, who makes an appeal to those who can help to come to their aid.
30 to 40 years ago, we used to feed ourselves with rice cultivated in these fields. But the salt water has brought many challenges for us because we cannot grow rice anymore. Also, we used to go fishing and get good catches every day. There was a type of grass that fish eat, but the salt has killed all the grass and the fish had nothing to eat.
It is speculated that the water flowing from Senegal may be responsible for the large deposits of salts which are visible on the land surface. Although salt plays a crucial role in maintaining human health and is the main source of sodium and chloride ions in the human diet, adding flavor and taste, for farmers and gardeners, it is an unwelcome addition to their crops.
On to some international news. In international news, the world's only nonuplets, 9 babies born at the same time, are in perfect health as they celebrate their first birthday in Morocco, according to their father. Churchill Balde has more in this story.
The 9 babies are still in the care of the clinic in Morocco, where they were born. The 5 girls and 4 boys were delivered by cesarean section at 30 weeks and weighed between 500 grams and 1 kilogram, according to Malian health authorities. 1 year on, the babies are in perfect health, according to their father, Abdel Kadir Abi, an officer in the Malian army. The babies broke the Guinness World Record for the most children delivered in a single birth to survive. Multiple births are risky, and mothers in such situations are advised to terminate some in other countries. There are also risks the babies could develop health problems due to their premature birth. They are living in a specially equipped flat owned by the clinic, where nurses are on hand to help care for Mrs. Cisse and her 9 babies. A strict diet has also been put in place for the children to ensure they receive all the nutrients they require. They will just have a small birthday celebration with the nurses and a few people from their apartment building, their father said. Their boys are called Muhammad VI, Umar, El Haji, and Bah, while the girls are named Khadija, Fatuma, Hawa, Adama, and Umu. Mr. Abi, Halima Cisse, and their 3-year-old daughter Suda are delighted to have such a big family. The children have not yet been to Mali, but they are already very popular in the country, where everyone is very keen to see the babies with their own eyes, their father said. Only 2 other sets of nonuplets have ever been recorded in history, but none of them survived past a few days. The 9 infants are the world's only nonuplets. For QTV News, I am Churchill Balde.
Well, what an incredible story. Many of us are praying for at least twins, triplets, and the likes, but nonuplets, 9. This is beautiful. And it's good to know that they're healthy. Now, let's go on to a recap of our main news stories. The Ministry of Health on Thursday inaugurated the National Health Insurance Authority Board, which will implement, operate, and manage Gambia's first universal health coverage insurance scheme. The National Center for Arts and Culture, in partnership with the Gambian National Commission for UNESCO, today joined the rest of the continent to celebrate African World Heritage Day. Give One Project Gambia and partner Paradigm Initiative on Wednesday held a digital rights and inclusion forum under the theme Towards a Digitally Inclusive and Rights-Respecting Africa. Omar Pierre Bojang, a Gambian residing in Germany and founder of Whipso Charity, explained to QTV how he lost his sight after waking up from a coma following a brief illness. And in international news, the world's only nonuplet, 9 babies born at the same time, are in perfect health as they celebrate their first birthday in Morocco. This is according to their father. Well, that's it for QTV News. Thank you very much for joining us. But don't forget to join us again at 10 p.m. for another bulletin.